Good day, this is Charles Celesta from BSN 12H. In this video, I will be performing a return demonstration on female urinary catheterization. Urinary catheterization is a procedure which involves insertion of catheter into the patient's bladder. So now, let's start by checking the doctor's order of the catheterization. And this is for us to make sure that we have the right patient and the right procedure to perform. And after that is we'll perform hand washing to avoid cross-contamination which may cause infection to our patient. So we'll also perform hand hygiene by using alcohol. Then, after that is we'll identify our patient and explain to them the procedure to alleviate anxiety and promote patient's cooperation. Okay, hello ma'am. My name is Charles Celesta, your student nurse for today. So, may I know your name and birth, please?
16 Rollion, July 14, 2000.
Okay, thank you. So, today ma'am, I will be inserting you a urinary catheter and we will be inserting it on your uteral orifice so that you'll be able to excrete your urine. Okay, so next is we will provide privacy by screening or closing the room. So by doing this is we're making the patient feel comfortable and respect their privacy. So we'll also position patient in dorsal recumbent with the knees flexed and will drape them to cover areas that will not be assessing and to also ease the patient's tension. So since the patient is already in a dorsal recumbent position, so let's start by by apply the direct light or for visualization of the genital area. So by doing this is we'll have a more clear view on the area which will make it easier for us to insert the catheter to the right part. Okay, I will going to expose the area that we need to expose. We'll hide the others. So now we'll start the catheter process by opening the tray and arrange equipment for convenience and accordingly, and also making sure to avoid contamination of the sterile items. Okay, so then using the sterile forceps, cleanse the area using the cotton ball with betadine. Cleansing the meatus and the surrounding area will reduce the spread of unwanted microorganisms to the patient's bladder. Now I'm going to okay, so discard the used cotton ball. So next is we'll open the set while observing the sterile technique, and after that we'll now put our sterile gloves. So this also for hygiene purposes and to avoid spread of unwanted microorganisms. Okay, so after wearing our gloves, we'll now put on the eye sheet. So I will discard this pad. Okay. Going to put the eye sheet on the burn. Okay. So now is we'll lubricate the catheter for about 1.5 inches to reduce friction. So while doing this, is we should be careful not to plug the eye of the catheter. So now is after that is we'll now pick up the catheter at least 3 inch from the tip of the thumb. Then place the thumb and one finger to hand between the labia minora. Then gently separate and pull it up. So okay, so separating the surrounding area or the labia minora gives us more visibility of the meatus or urethral meatus where we insert the catheter. So now we'll insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. Okay, so now if the specimen is to be collected, we'll have to pinch the catheter with the thumb and our finger while placing the specimen container in position. So after inserting and pinching, we'll rest our hand in the pubis area while holding the catheter in a place to prevent pulling and pushing the catheter. So pulling and pushing of catheter can promote entry of microorganisms which may cause infection. So after that we'll now connect the catheter to the urine bag. Okay, so we'll inflate the balloon 10 to 15 cc of sterile water using a 15 to 20 cc syringe. So inflating the balloon will prevent the catheter from seeping out the body. Okay, we'll hold this into the dart position. Okay, so discard the syringe, and after that we'll secure the indwelling catheter by topping it to the patient's thigh. And in doing this, we should make sure to tape properly so that when the patient moves in, it will not fall off. So we should also allow some slack of tubing to accommodate the patient's movement. Okay, we'll insert this into his thigh. Okay. So after the process we'll now place our patient comfortable and do the aftercare. So first, going to remove the eye sheet and discard it. So now we're going to lie down the patient comfortably. Okay, now you lie down. After that is covered the area that exposed. And next is we're going to remove the gloves and perform hand hygiene. Okay, discard it as well. Okay, so After everything is will record and document the procedure, which includes the time of procedure done and amount of the color of the initial output. Okay. After everything is will record and document the procedure, which includes the time of procedure done and with the amount and color of the initial output. Okay, and after everything is will now perform hand hygiene.